Hello everyone. Today we'll be discussing about the ULNA. Now, those who have not watched the first part of the video of the general features and attachments of the ULNA, please do watch the video. It contains a lot of information. And in this video, we are going to discuss about the ossifications and clinical anatomy related with the ULNA. Okay, so let's start. Now, coming to the ossification, now the shaft and most of the upper end of the ulna. Okay, this is the upper end of the ulna and this is the shaft. I hope you know it. Now the shaft and most of the upper end of the ulna ossify from a primary center. Okay, so it ossifies from a primary center which appears during the time period of 8 week of development. Okay, now the ossification center, the primary ossification center will appear during the 8th week of development. Alright. Now next coming to the Olecranon process. Now I hope you know that the Olecranon process has many surfaces. I guess this is the medial surface, this is the anterior surface, superior surface, posterior surface and the lateral surface. Now considering the superior part of this Olecranon process, now it ossifies from a secondary center which appears during the 10th year. Okay, remember it, the secondary center will appear during the 10th year. Alright, and it forms a scale like epiphysis which joins the rest of the bone by the 16th year. So the ossification center, the secondary ossification center will appear during the 10th year and it will generally form a scale like epiphysis. Alright, and it will join with the rest of the bone, the rest of the shaft by the 16th year. Now let's come to the lower end of the ulna. Now this is the lower end of the ulna, this is the ulnar head and this is the styloid process. Now in the lower end, the secondary center appears during the 5th year. Okay, now for the upper end, the superior part of the Olecranon process, the ossification center, the secondary center of ossification appeared during the 10th year. So just correlate with it, and in the lower end, the secondary center of ossification will appear during the 5th year. Alright, so 10th year and this one 5th year. Now it joins with the shaft by 18th year. Okay, now it will join with the shaft by the 18th year. Alright, so in case you have found this interesting, see, the ossification center, the secondary center of this lower end appeared during 5th year, so it appears early compared to the compared to the upper end, the superior part of Olecranon process, which appeared during 10th year, and this appeared during the 5th year, and it joins with the shaft by the 18th year. So it appears first, but it joins at a later period. Okay, with the shaft, it joins with the shaft at, it fuses with the shaft at by the 18th year. Okay, but this fuses with the rest of the bone, the center of ossification for the upper end. Okay, the epiphysis, after forming the scale like epiphysis, it will join with the rest of the bone by the 16th year, and it joins with the rest of the bone by the 18th year. Now this is the growing end of the bone. Okay, I determined the growing end of the bone by one more correlation. See, this nutrient foramen which was directed upwards, which means that the lower end is the growing end of the bone. Okay, now let's discuss about the clinical anatomy. Now coming to the fact that the ulna is considered as the stabilizing bone of the forearm. Okay, it's considered as a bone which makes your forearm to be stable. Okay, now it functions by particularly by this trochlear notch. Okay, now this trochlear notch helps in gripping of the trochlea of the humerus. Okay, so I hope you remember the trochlea which was present at the lower end of the humerus. Now this trochlear notch is an articulation with this lower end of the humerus, that is the trochlear notch. Now on this framework, what happens is the radius can pronate and supinate. Let me bring the radius. So the radius can pronate and supinate on this foundation. See, so this is what happens. So it helps the radius in pronation and supination of the hand. Alright. Now, that being said, the shaft of the ulna, it may generally fracture either alone, I mean by itself, or along with that of the radius. Now it may fracture alone, or the radius can fracture with the ulna togetherly. Okay. Now, one important thing to be remembered is that the union between these two bones must be prevented. Okay, I mean the cross union between the radius and ulna must be prevented. It's due to the preservation of pronation and supination of the hand, because if there would be by chance any cross union between these two bones, okay, so what happens is there is dislodgement and dislocation of the of the structure of the anatomical structure of the forearm, which prevents the pronation and supination of the hand. All right. Now let's discuss about the Madelung's deformity. I hope you have seen the images which I have provided with this video clip of the Madelung's deformity. I have also given you the X-ray samples of how the deformity looks, okay, when diagnosed via X-rays. Okay, now in Madelung's deformity, what happens is there is dorsal subluxation or displacement of the lower end of the ulna. Okay, so the lower end of the ulna gets displaced, which generally results as a consequence of the improper or retarded growth of the lower end of the radius. Okay, so due to the retarded growth of the lower end of the radius, what happens is during the various movements of pronation and supination of the wrist joint, the ulnar head, I think you know that in this ulnar notch of the radius, in relation with the ulnar head, it forms the inferior radioulnar joint. Now what happens is the ulna does not fit properly within this area, and what happens is the head of the ulna can be seen as protruded, okay, dorsally when you view someone's wrist. So this was the basics of the Madelung's deformity. I hope you understood well in this video about the ossification and clinical anatomy of the ulna. So keep watching until next time.